This podcast is sponsored by the Tree of Life Memorials and Digital in Stone. This is a new platform to create digital memorials, environmental legacies, and fine art monuments. This way we could share the stories, preserve the memories, conserve the land, and connect the souls, because love never dies.
This podcast does not provide medical nor legal advice. Please listen to the complete disclosure at the end of the recording.
Hello, and welcome to Everyone Dies, the podcast where we talk about serious illness, dying, death, and bereavement. I'm Marianne Matzo, a nurse practitioner, and I use my experience from working as a nurse for 45 years to help answer your questions about what happens at the end of life.
And I'm Charlie Navarrete, an actor in New York City, and here to offer an every-person viewpoint to our podcast. We are both here because we believe that the more you know, the better prepared you are to make difficult decisions in the middle of a crisis.
So welcome to this week's show. Please relax, get yourself something cheering and warm to drink, and some pie. Pie would be good.
Pie.
And thank you for spending the next hour with Charlie and me as we continue our discussion about stomach cancer. Like the BBC, we see our show as offering entertainment, enlightenment, and education, and divide it into 3 halves to address each of these goals. Our main topic is in the second half, so feel free to fast forward to that babble-free section if you need to. In the first half, Charlie has the best foods to eat to prevent stomach cancer and our recipe of the week. In the second half, I continue our discussion about stomach cancer. So go back and listen to part 1 for risk factors, symptoms, diagnoses, staging, and survival estimates. This part 2, has an overview of treatment options that can be expected, living with cancer, and what the end of life is like for people with end-stage stomach cancer. In the third half, Charlie has another journal entry from our friend Greg, whose wife is in a memory care center because of late-stage Alzheimer's disease. So, Charlie, if I want to lower my risk of getting stomach cancer, what suggestions do you have?
Well, this week I want to give out some ideas about how to lower your risk of getting stomach cancer. Many of these things we have chatted about before, but that is not going to stop us from mentioning them again as they relate to stomach cancer. We all need reminders, folks. Just think of me as your old Hispanic grandma reminding you of the things she has been telling you all your life and to which you never pay attention. And it's about time you start paying attention. Thank you, Grandma. Let's begin.
You channel her well.
Yes. Let's begin with smoking. And let's end it too. Smoking can increase the risk of cancer of the upper stomach, the portion closest to the esophagus. Tobacco use increases the risk for many other types of cancer as well. If you don't use tobacco, don't start. If you do smoke, help is available. Check out the reference in our show notes. And if you chew tobacco, do not swallow the juice.
And if you chew tobacco, I am your old Hispanic Italian great-grandma. If you chew a tobacco, stop it. It is not good for your teeth. It can result in mouth cancer, throat cancer, stomach cancer. That tobacco in direct contact with your mucous membranes is not a good combination. So I know you're not going to listen to me, but trust me, I've seen people with those kinds of cancers from chewing tobacco, and it's a tough one. And that's all I'm going to say about that.
That's a disgusting image, so keep that image in your mind if you're a smoker. Next, exercise.
No, if you're a chewer.
Yeah. Exercise. We have a few podcasts on this topic, so please listen to them. Being fit and active can lower your risk for many different types of cancers. Weight. How is your weight? People who are overweight may be more likely to get stomach cancer. I'm sure you don't need me to advise you to lose weight. We regularly talk here at Everyone Dies about food, and what we eat may make a difference in your cancer risk. There is never a guarantee against getting cancer, but there are some things that can decrease your risk. Foods to consider avoiding are genetically modified foods, typically referred to as GMOs, which stands for genetically modified organisms. GMOs are part of a growing industry that has been infiltrating the food supply at a very high rate. Over 90% of the soy and corn grown in the United States are genetically modified. There has not been a lot of research done about how exactly these genetically modified foods will affect the human body. For this reason, it is best to avoid these types of foods as much as possible. Our old friend, microwave popcorn.
Is this Jiffy Pop?
Pardon?
Is it Jiffy Pop?
Oh,
it's microwave.
Wow, I have it.
Not.
Yeah, that's it. Right, exactly. I was trying to think, how do you put that aluminum into the oven? First, the kernels and oil used are likely genetically modified. Microwave popcorn comes in bags that are lined with chemicals. These chemicals are not great for the digestive system. Go back to the old-fashioned way of popping corn and read the labels of the food you eat. Canned food. Most cans that are used for food are lined with a product that is called bisphenol A. This is also referred to as BPAs. BPAs have been shown to alter brain cells genetically in rats. Thermal paper, plastic goods, dental composites, and water lines often contain BPA as well. Choose vegetables that are in glass jars, frozen, or best of all, fresh. Onions, garlic, leeks, and chives have compounds that have been found to have anti-cancer properties by reducing inflammation and having antifungal properties. Include foods that have vitamin C and E because they neutralize free radicals in the body while also strengthening the immune system. Foods rich in vitamin C include kiwis, oranges, broccoli, bell peppers, and dark leafy greens. Lemons and grapefruit are also great choices. Vitamin E-rich foods include almonds, sunflower seeds, spinach, and Swiss chard. Mushrooms have beta-glucans, which are a naturally occurring polysaccharide that aids the immune system in combating cancer cells. Turmeric contains curcumin, which is a phytochemical that inhibits the bacteria Helicobacter pylori, which is linked to stomach cancer. A carcinogen that is known as heterocyclic aromatic amines. Also, lowering the amount of red meat that is in your diet can reduce the risk of developing stomach cancer. It is recommended that instead of grilling red meat, you should broil, bake, or prepare the meat in a skillet instead. Refined sugar. Most of the sugar supply that is found in the United States is made using sugar beets that are genetically modified, so it is best to choose a natural alternative. Some better choices of sweeteners include coconut sugar, organic honey, and maple sugar. These natural sweeteners are also a better choice than artificial sweeteners. Smoked, pickled, and salted foods. One of the preservatives often used is nitrates to prolong the shelf life of these products. Nitrates can accumulate throughout the body and eventually cause damage at the cellular level. Carbonated beverages and sodas. These drinks are filled with high fructose corn syrup, which you already know is bad for your health. Diet sodas are not any better because of the artificial sweeteners used. White flour. When the flour has been refined, the nutritional value is removed and then it is bleached using chlorine gas. Whole wheat flour is a better choice. There are references in the show notes regarding diet and physical activity for cancer prevention, as well as our previous shows on the topic. This week's recipe of the week was tough to choose because we wanted to make it fit with reducing stomach cancer risk. A fresh fruit salad would work, or vegetables on a platter. These choices may or may not make your funeral lunch contribution popular. So we thought, how about popcorn balls? Non-GMO, popcorn shaken in a pan of oil like Dad used to make. And instead of being chocked full of corn syrup and butter and or sugar-laden marshmallows to hold them together, using honey instead. Or, for even less work in label reading, Kettle Brand. Marianne, they don't sponsor us, but I believe they should. But Kettle Brand sells non-GMO popcorn, available in 5 varieties: maple bacon, salt and fresh ground pepper, sea salt, Chiraca, and white cheddar. The new offerings boast 50 to 53 calories per cup, are made with healthy oils and only non-GMO ingredients without trans fats, MSG, or preservatives. If you get the bag of the Kettle sea salt popcorn, drizzle warm honey, then stir and shape into small balls. All the details in our show notes. These small balls fit perfectly into your next funeral lunch offering. Please go to our webpage for this week's recipe for popcorn balls and additional resources for this program. Your tax-deductible donations are always welcome so that we can continue to offer you quality programming. Thank you in advance for making your donation at www.everyonedies.org. That's every, the number 1, dies.org. Marianne?
Thanks for that, Charlie. About 99% of what I eat is not on the list.
Yeah, I didn't want to make that comment. Mine is probably like about down to 80%. So, but yeah, but I have to tell you what I do most of the time. I will take 2 or 3 bites of something that I really know is not healthy for me, and that'll do it. It's enough to to get me through the night, if you will, and that's it. I don't chow down an entire candy bar, or I do like the microwave popcorn though, but I don't eat the whole bag anymore. Just a couple of handfuls, and that's it.
Good control. So, Charlie, what I'm going to do is pick up where we left off on the first part of All About Stomach Cancer and move on to treatment options. I always talk about treatment as an option and how it fits into your lifestyle, your goals, your finances, what it is you want. So be sure to ask questions of your oncologist. Some people feel that they don't want to bother them with questions, but your oncologist is the person who's managing your treatment. So they're the ones that you need to ask questions of. We have a resource in our show notes with questions that you can use to guide your discussion. So if you're kind of, nervous about asking your oncologist, or you don't know exactly how to phrase the questions that you have, take a look at those. They might help you. Now, once the stomach cancer has been diagnosed, which we discussed in the first half, it is the staging that guides what the treatment options are. Now, if you remember, all cancers are staged on a 0 to 4 scale. So if the cancer is stage 0, which means it's only in the stomach lining, and then there are 2 treatment options. One is a gastrectomy, which is surgery to remove all or part of the stomach and the nearby lymph nodes. That's really the main treatment for stage 0 stomach cancer, which is known as carcinoma in situ. The second option is endoscopic mucosal resection using an endoscope, which is kind of the same way that they diagnosed the cancer in the first place, which is a thin lighted tube that's inserted through the mouth and down the throat. And they're looking for those abnormal areas, and they are going to remove those growths from the lining of the digestive tract or the stomach without having to open you up for surgery. And we have a picture of that in our show notes. This is typically done in people with really small tumors who have a low risk of it spreading to nearby lymph nodes. Now, the treatments for stage 1, 2, and stage 3 stomach cancer are really the same. When possible, the first treatment for stages 1 through 3 cancer is surgery. And you might hear your healthcare professionals call it debulking surgery. This is surgery to remove as much of the cancer from the stomach as possible. You might hear your surgeon talk about getting clear margins. That's the goal. So the margins are the edges of the surgical cuts that the surgeon makes. During cancer surgery, the surgeon tries to remove the whole tumor and some normal tissue around it. This area of quote-unquote normal tissue is important because cancer cells could be in that tissue too. So they look to see if the edge or margin has part of the tumor. There may be that there are cancer cells left behind. The goal of surgery is to make a clear margin, that is, clear of any cancer cells. A clean or clear margin is when there are no tumor cells within 1 to 2 millimeters of the edge of the specimen that's been taken. If the tumor cells are closer than this to the margin, more surgery or radiation may be needed. And I know a lot of what I'm saying, you might have to say, God, I got to go back and listen to that again. Please do, put it on that setting that's, it'll read it to you really slow because sometimes it's kind of hard to get your head around it the first time you hear it. So the second treatment is gastrectomy. Surgery to remove all or part of the stomach and the nearby lymph nodes is really the main treatment for stages 1 through 3 stomach cancer. Some people may receive chemotherapy and or radiation before or after surgery. So typically, what they try to do is they want to do what's called adjuvant therapy, which is surgery to remove the cancer tumor or resect, take out the organ itself, and then do chemotherapy or radiation afterwards. But sometimes there's reason that that's not possible. Maybe the tumor is too big in order for that to be able to be removed with surgery. So they want to shrink the tumor first using chemotherapy or radiation and then go in and do surgery. And that's called neoadjuvant therapy. So I worked in a cancer center for many years. I know those words are thrown around and sometimes you say, well, I don't even know what they're talking about. But that's what they're talking about. It's like adjuvant is when the surgery comes first and then chemo and radiation. Neoadjuvant is when the chemoradiation comes first and then the surgery. Now, there are many chemotherapy drugs that are used in stages 1 to 3 stomach cancer. And these drugs may be given alone. They can give them in combination. The other option is endoscopic mucosal resection, which I mentioned in stage 0. It's a less invasive procedure that can be used with small stage 1 tumors that have a low risk of spreading to nearby lymph nodes. And your oncologists, when they look at the pathology from the initial surgery that they did and they looked at your tumor type and all of that, that's how they make the determination. Is it safe to do this? Is it better to do that? So that's all stages 1 through 3. Treatment for stage 4 cancer, stomach cancer, is stomach cancer that cannot be removed by surgery, and also recurrent stomach cancer, meaning you've gone through surgery, you've gone through chemo, you've gone through radiation, and then the stomach cancer comes back. That's called recurrent cancer. So treatment of stage 4 stomach cancer is any stage of stomach cancer that cannot be removed by surgery, and there could be a lot of reasons why they can't remove it. It could be the size of the tumor, could be the health of the person, it could be the age of the person, could be the goals of the person. The person might say, I don't want to have surgery, I'll do this other stuff, but I'm not going to do surgery. And it's also used for recurrent stomach cancer. So the treatment is considered palliative. Palliative therapy is treatment meant to improve the quality of life of people who have serious or life-threatening disease, one of which is cancer. Many of these treatments for cancer, such as chemotherapy or other kinds of drugs and radiation therapy, can be used for palliative therapy to help the person feel more comfortable. We have a lot of shows where you can learn more about palliative care, as well as resources in the show notes, so take advantage of those if you want to learn more about palliative care. Now, there are many drugs that are used for what's called palliative chemotherapy for advanced stomach cancer that can be given or given in combination. People who have side effects from the cancer or its treatment may be given other treatments to help reduce those side effects and feel more comfortable. For example, if there's a blockage in the stomach, the blockage could be opened by laser therapy or a stent placement, like a straw through a blockage, or even surgery to bypass the blockage. Radiation therapy or surgery can be done to stop bleeding, relieve pain, or shrink a tumor that's blocking the stomach. Receiving a cancer diagnosis is a major life disruption that causes physical and emotional side effects. The more information from reputable sources will give a person a greater sense of control. Be sure to check out the resources that we give you with each show because they've been checked by me. And so I don't put anything in there that is not accurate or not from a good source. Also, all of our podcasts are evidence-based. A lot of research goes into them, so you can listen to those too for other areas related to this diagnosis. There are resources about the side effects of the treatments that I've just talked about that are in our show notes because they're wide and they're varied and they're specific to each drug. And you'd go to sleep if I tried to go through all of that. But there's a really good resource there that you can look it up. You don't have to look far. So the job of the stomach is to begin the process of breaking down the food that we eat using enzymes and stomach acid and to prepare the food to move through and slowly release the food into the small intestine. The stomach can hold about a liter of food. So if you think about that liter bottle of Coke or Pepsi that you drink, that's how much food can fit into your stomach. When the stomach is empty, one of its jobs is to send signals to the brain that says, hey, time to eat. Now, if part or all of your stomach has been removed, you're still going to eat food. But you don't have the first part of digestion, which is your stomach. So, since it's not there, it's the work that the stomach usually doesn't get done. So all the things I just told you that the stomach does are gone, and changes have to be made in how we eat. That means that about 6 to 8 weeks after your surgery, you're going to be able to start on solid foods. And that means the person who's had their stomach removed has to eat smaller meals, having at least 6 to 8 small meals per day. Because remember, you used to have a liter gas tank there, and now you don't have anything. So what's going to happen is when you eat the food, you're going to swallow it down your throat, and it's going directly into your small intestine. And so your small intestines say, wait a minute, this stuff's not being delivered the way it's supposed to be. It's in clumps, and it's a large amount, and what am I supposed to do with this? So what you do is you're going to have to eat smaller meals so your small intestine doesn't freak out. You want to avoid drinking a lot of fluids with your meals. Remember, fluids are going to fill you up, and you're going to need the nutrition from the food because you can only eat small amounts of food. Third, you're going to really need to chew your food well to make it easier to digest and easier for your body to absorb. Chewing your food well will also avoid pain or discomfort after eating. Remember, your stomach used to kind of chum that up and break it down, and you're going to kind of have to do that work by chewing better. Make sure you take the recommended vitamins every day and so that you get all the nutrients that you need. Because you're eating less, and you might not get everything you need, but at least you can take it in whatever your oncologist or dietitian tells you. Take this is what you need. Now, you're going to be working with a dietitian. Don't be afraid to call him or her. They're going to help you with your individual needs. Make sure you keep their appointments because you think, oh, that's not important. But really, your quality of life and how your body heals is going to depend on your nutrition. And, because if you're not eating right, you're going to feel tired. You're not going to want to get out of your lazy boy chair. And, you didn't go through all of this to sit in your lazy boy chair. So work with your dietitian. Have small meals every few hours, even if you don't feel hungry. Remember, you don't have your stomach there to send any messages to anybody to say, hey, time to eat. So you have to kind of either use the timer on your phone or whatever to remind yourself, hey, it's been 2 hours. I need to go eat something, or I need to go have a protein drink or something. Don't wait until you feel hungry. Not going to work. It's going to take time to learn your body's new hunger cues. And instead of feeling that hunger pang, you might feel tired or weak or dizzy or lightheaded. And these might be your new cues to eat. So what can you expect from a side effect of having your stomach removed? Well, weight loss is expected, and the fastest will come in the first month after surgery. Weight loss will gradually continue for about 6 to 12 months and includes both fat and muscle loss. Now, there's really not a problem losing fat, but muscle, your heart's made of muscle, your organs are made of muscle, and your muscles are made of muscle. So you want to make sure that you maintain your muscle mass so that your body doesn't say, I need more muscle, I've used up all their muscle mass, now I'm going to go and use the muscle mass from their heart or from their lungs. You don't want that to happen. You need to eat enough protein. So this is why about half of each meal must be protein in order to protect your muscle mass. You might feel full fast or just not feel like eating. So when eating, be sure it's high calorie, high protein food every 1 to 2 hours until you can eat more. About 6 to 12 months after your surgery, you should be able to eat about a child-sized portion of food. So the big all-you-can-eat places, you just, unless they let you, sometimes your doctor will give you a card so that you can order off the child's menu. So that would be a good option to figure out. But there are just, those huge quantities of food you're not going to be able to eat anymore. You could take, like one of those meals and probably have it last 3 days. One of the things that happens is that you don't feel hungry, you forget to eat. So set a timer to remind yourself to get something to eat. Protein drinks can help you get the protein you need. Your dietitian will give you lots of good recipe for smoothies and that kind of thing. So make sure that you keep them on speed dial. Now, nausea is not uncommon, especially if you eat too much too fast or don't chew your food well enough. So, and also, if it's been more than 2 hours since you last ate, the nausea may be your new hunger signal. If nauseous before eating, choose foods that are cold, light, low fat, that don't have a strong smell or flavor. And that way you'll be able to eat. So like something like yogurt is a good protein source. It's cold, doesn't usually smell. And if you're feeling nauseous, you should be able to at least get that down. Now, constipation. You are more likely to be constipated if you don't drink enough fluids. And it can be difficult to drink enough fluids after surgery because you feel full really quickly. So you might take a sip or two and say, I feel full, and that's not going to help you get your 64 ounces a day that you really need. So in order for constipation to be avoided, you're going to need those 64 ounces of fluid. Move around by taking short walks and talk to your dietitian. The 3 things that keep us going to the bathroom are enough roughage in the diet, enough fluids, water, and movement. And You can't have roughage in your diet if you're not drinking enough water because you'll get stopped up. And after surgery, it's going to be hard to move around because you don't feel quite so well, or you might be sore. But know that some people can get readmitted to the hospital and can get bowel instructions because of the constipation. So it's really in your best interest to be sipping on that fluid all day and make sure that you're getting your 64 ounces. If you get up to go to the bathroom, maybe take a little trek around your house just to keep things moving, and you will thank me. Bile reflux. Now, without a stomach, you don't produce stomach acid, so you're not going to have acid reflux, okay? But you're at risk for bile reflux, which is when the bile, which is the digestive liquid produced by your liver, backs up into your esophagus, which is that tube between your mouth and the rest of the digestive tract. The cause of and treatments for bile reflux are different than acid reflux. You are more likely to have bile reflux if you lie completely flat overnight. So sleep with your head elevated at least 30 degrees, which is about 6 inches or more. Also, stay upright for at least 30 to 60 minutes after eating. These two things should help you not have bile reflux. Another thing that happens is what's called dumping syndrome. Now, dumping syndrome happens when a large amount of food or undigested food pass too quickly into the small intestine. Symptoms of dumping syndrome can happen right after you eat, which is called early dumping syndrome. So you can eat something, you could still actually be sitting at the table and you say, oh my God, and you go run into the bathroom and you have like this explosion. Or you can have late dumping syndrome, which is hours after eating. So symptoms of urgent diarrhea, cramping, feeling faint or weak are those early dumping syndrome symptoms. Prevention is avoiding foods and drinks that have added sugars. Make sure you have protein at every meal and every snack. Chew well. And avoid meals that are high carbohydrates. The carbohydrates, those simple sugars, are the things that will have you experiencing the dumping syndrome. And once you have it, you'll say to yourself, okay, I need to not do that anymore. The last thing is alcohol. Alcoholic drinks increase the risk of dehydration, and even small amounts of alcohol can cause intoxication and low blood sugar after a total gastrectomy. So be cautious with any alcohol intake. You might say, I always had a drink, before I ran to Walmart because, it's the only way I can tolerate it. Well, don't have that can of beer or whatever it is, because in the past, maybe you could drink 3 beers without feeling it. With this surgery, you could get through a quarter or half of the beer and you'd say, oh, that hit me, because you don't have that stomach holding that fluid. So let's go to end-stage stomach cancer. Over 50% of patients can achieve a cure from stage 1 stomach cancer. But early stage disease, which is stage 2 disease, only accounts for about 10 to 20% of all people in the United States to be considered cured from stomach cancer. So in stage 2, it's about 10 to 20%. The remaining people diagnosed with stomach cancer are diagnosed with either stage 3 or stage 4 disease. So when we would talk about this into business, we'd say, stomach cancer is typically diagnosed in late-stage disease. That's also true of cancers like ovarian cancer. And why? Because there's no test to diagnosis. There's very vague symptoms that could be related to almost anything. So it's easy for us to say, oh, it's just because I'm getting older, or it's just because of this or because of that. It's easy to kind of pretend it away with stage 1 and stage 2 symptoms because they're pretty vague. They're not specific. And it's not until people kind of start feeling pretty poorly when they're into stage 3 that finally they go to a healthcare practitioner and they say, well, I've lost 30 pounds in the last 2 months. that then there's a response to say, we need to figure out why. The overall 5-year survival rate for patients who are in stage 3 or stage 4 ranges from almost 0 for patients with stage 4 disease to nearly 50% for patients with stage 3 disease. So stage 4 disease is not, stage 4 stomach cancer is not something that has a good 5-year survival rate, clearly. And stage 3 disease is pretty serious also. Now, stomach cancer can metastasize or move to other organs. That's what metastasize means. It goes from those cells, those stomach cells, and it can move on to other organs. A common finding during a physical exam in end-stage stomach cancer is a noticeable mass or solid feeling bump around the stomach area where the stomach used to be. Different types of cancers tend to move to specific places. So let me tell you where stomach cancer, which is the main site that we're talking about, where does stomach cancer tend to metastasize to? So the first place is what's called the peritoneum, which is the lining of the abdominal cavity. So you have this, like Tupperware container that's filled with all these organs. So if you had peritoneum metastasis, it's like the lining of that Tupperware has cancer or has cancer cells. The symptoms that you'd feel with that kind of metastasis is a bloating feel, abdominal pain, and constipation. Second place that stomach cancer will tend to go is the liver. And the symptoms that you'll see are jaundice, somebody who's turning yellow, feeling really tired, and having a fever. When my daughter and I, the youngest one is a nurse, when we were watching the final interview of Toby Keith, and we looked at him, we said, oh, look how yellow he is. You could see the jaundice. Now, I don't know if he had liver metastasis, but he looked as though he did, or at least had the jaundice. The third place that you'll see metastasis to is the bone. And the symptoms you'd have with that are the bone breaking, having a fracture, bone pain, or bone swelling. And bone pain can be pretty painful, but there are good drugs to help with that. So if you're having that symptom, the point of me telling you about these symptoms is so that if you or a loved one who has stomach cancer have these symptoms, you could say, well, what does my bones hurting have to do with my stomach cancer? Just so you know. Okay, I need to call the oncologist because I'm having this symptom. The next kind of favorite place for stomach cancer to metastasize to is the brain. And with brain metastasis, you'll see people will have seizures. They'll be confused. They'll have trouble remembering things, where they put their stuff. Sometimes who people are, how to balance a checkbook, how to get home when they're driving. The next place, kind of favorite, is distant lymph nodes. Now, we talked in the first part about there's like 600 lymph nodes within your body, and there's local lymph nodes, and those are the ones that are the local lymph nodes are the ones that are near the stomach itself, and the distant lymph nodes are the ones that are further away. They could be in the armpits or the groin or somewhere further away. So symptoms you'd see with that would be swollen lymph nodes, usually in the neck, under the arm, or in the groin. The last typical place that you'll see metastasis is to the lung. And with that, people will have trouble breathing, they have more unexplained weight loss, and they could be coughing up blood. Now, it's not to say that the cancer couldn't metastasize to other places. It can, and often does, do whatever the heck it wants. But, we have a saying in healthcare that if you hear hoofbeats, you look for horses and not zebras. So this list are the horses, the typical thing that you would see. And that doesn't mean there aren't zebras in the world. Now, some people with metastatic disease may be offered additional chemotherapy, targeted therapy, you'll hear that term used, which are medications that specifically target cancer cells while leaving the healthy cells alone. And they generally cause fewer side effects than chemotherapy. Another option is immunotherapy, which is a drug that identifies the immune cells in your body and then wakes them up. Part of the reason why cancer grows is that your immune system does not recognize the cancer cell as abnormal. They just think, oh, new cells are moving in, cool. And they ignore it as a threat to the body. When you take an immunotherapy drug, what it does is it says to the immune system, get up and do your work. And so it wakes up or activates that immune system to fight the cancer. Now, some people decide that treatments are really too hard on their body, and they decide not to continue. We have podcasts about what to do when the chemo's not working, or what the concept of palliative care chemotherapy is, and information from studies about how well it works. So those are two podcasts to check out if you're or someone you know is in a position of having to think about that. The causes of dying from stomach cancer tend to be related to bleeding, infection, and failure of the organ where the cancer has metastasized. So, what can you do to support someone with stomach cancer? It's important to be supportive when a loved one has stage 4 cancer, and support really means different things to different people. But knowing a few tips can give you a starting point in terms of how you approach your loved one, and you figure out what will make them feel supported. I had a friend years ago who had breast cancer, and she lived in New York, and I was in New Hampshire at the time. And every week, she always had like a sniffy nose. So every week I would send her a card with an antique handkerchief in it. And just to say, thinking about you, sending you positive vibes. It was just there. It didn't require anything from her, just to receive and to know that somebody was thinking positive thoughts about her. That worked great for her. That might work great for somebody you know, or it might be something different. So, some things to think about. Keep the focus on the person with the cancer. It's important to focus on the person with the cancer's interests rather than talking about your own personal experiences or complaints. It's always just sort of fascinating to me when somebody goes to the hospital to visit somebody who's is with them at an infusion for their treatments. And instead of kind of letting that focus be on the person who's having the treatment, they're going on about the troubles with their kids and this and that. And I knew somebody else with cancer, and it's like, I'm using all my bandwidth here to deal with my cancer. I just don't have it for your personal experiences and complaints. So they're not going to tell you that, but I will. So just kind of keep the focus and don't go off into these other lands. Stay in touch with them. Avoiding or ignoring someone with stage 4 cancer is likely to make them feel worse. Let them know they can reach out at any time and check in with them often. Now, you tell them, anytime you reach out to me, and people may, but most people won't because they don't want to be a bother. But if you send them a text with a funny meme or whatever and just say, I'm thinking about you, it doesn't require any effort on their part. They know that you're still in their life and that you still love them. It's kind of a good way to just be there. If they do want to talk, though, be a good listener. Sometimes people with cancer just want someone to listen without interruptions or interjections. So be truly present. Give them your undivided attention. Shut off your phone. Put it away where you can't see it. Take off your Apple Watch. Apple Watches, I'm going to sound like an old lady now, but they drive me crazy because you're talking to somebody and I don't know, they must get a buzzer or something and they just turn and look at it and they read whatever it is and then they go back to you. And it's like, but it happens like, I don't know if you guys have this experience, it happens like all the freaking time. Take off the watch. Put away the phone. I mean, these people are very, very sick. You don't have forever to visit with them. So put the technology away. Next, don't compare them to other people with cancer. It can be tempting to talk about other people and their cancer experiences. And, when Joe had this, his entire throat blew open and bled everywhere. I don't know, but don't do it. It's better to let them be their own person, let them share their thoughts and feelings without comparison or horror stories from people you've known. Last, avoid asking personal questions. Don't ask someone with stage 4 cancer about their lab results or how long does their doctor say they have. If they want to tell you, they'll share that information. But it's really personal. And they might not want to have to say it out loud. They're dealing with their own loss. They're dealing with their own grief. And for you to say, so how long does your doctor say that you have? And you have to say, well, 3 days. It's like nobody wants to say that out loud. But if they want to tell you, they will. Charlie, any questions for me?
What's the word I'm looking for? Basically, early on you were talking about, using more technical language. And at some point you mentioned if doctor says something you don't understand, to ask. And it's just that. I'm lucky. I really have been, relatively healthy. But, the few times something was going on, I never shied away from, from asking, I'm sorry, doctor, I don't understand that. And sometimes I would take notes. As long as I, let them know in advance, this is what I'm going to need to do. Just always, what you're talking about, you gotta ask questions. People are not comfortable asking questions. I get that, but you have to ask. You're advocating for yourself. And the other thing, what you just ended up with, Marianne, those damn, Apple Watches, iPhones. It's bad enough it happens in everyday life, but, to your point, if someone's sick, someone's very sick or dying, and you have to look at your phone, you have to look at your wrist to see, what buzzed. It's that. And as the person who is sick, again, you should speak up. It's...
I don't know. I mean, even when I'm not sick, and the kids are like constantly looking at their wrists and reading, and or I've seen nurses do it too. I as unshy as I am, I never speak up and say, "Will you turn that around and quit looking at it?" Because it's like, people must know that if they're having a distracted conversation, that it's not being fully present and mindful and rude.
No, I disagree that people must know that. No, not at all. I disagree. It's just, the culture of all that is changing. And it's just changing faster and faster. I don't say that every time to anyone, but there are times when, I'm in the middle of even if you're just in the middle of a conversation, it's like, we're talking. Why do you need to, look at a phone or something? It's just changing society, changing culture,
And in that case, not for the better, in my humble opinion.
Yes. Now, for our third half, as Marianne mentioned, this is a journal entry from our friend Greg, whose wife is in a memory care center because of late-stage Alzheimer's disease. It matters not who we are caring for, parent, sibling, child, friend, or spouse. It's still heartbreaking. I'm fortunate and blessed to be caring for my wife of 50 years. It's the honor of my lifetime. But boy, do I miss having her whole. The loneliness is unrelenting. One of the things I miss most seems almost silly. I miss having someone to check in with. Someone to call and say, I'm running a little late. Someone to call and say, God, I had a great day today. Someone to tell that I'm upset or frustrated. It validated that I mattered. It's almost like it didn't happen if I have no one to tell. The story of the tree falling in an empty forest. Was there any noise if no one was there to hear it? Honey, I'm home. Sometimes I still yell that as I enter the back door. I guess I'm hoping that she'll answer, but knowing she won't. I miss saying things like, can you believe that? Or look at that moon. Are you hungry? Do we need anything from the store? My comments today are, you are beautiful. I love your blue eyes. Good job. Hi, girlfriend. I'm so proud of you. I love your pretty outfit. I love you, pretty girl. You are my sunshine. Then repeat a few minutes later, because she doesn't respond. She doesn't smile. But I still hope she understands that I am making love to her through my words. It is sad, but I can't wallow in pity or become angry, for I've found that only makes things worse. But it does not mean that I am okay with it, right? It just sucks sometimes. You know what I mean?
I know what you mean.
So sad. But,
I love reading Greg's journal entries.
What a big heart, and he just keeps going forward. You feel bad, but you keep moving forward. And that's it for this week's episode. Please stay tuned for the continuing saga of Everyone Dies, and thank you for listening. This is Charlie Navarrete, and from writer Neil Gaiman, everybody is going to be dead one day. Just give them time.
And I'm Marianne Matzo, and we'll see you next week. Remember, every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.